Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left third molar or wisdom tooth and its association with the nerve. Here you can very clearly see on the panoramic view that the lower left third molar is significantly close to the inferior alveolar nerve. On the transaxial view, which is basically the proximal view, we will be able to show you that the lower left third molar, this is the lower left third molar mesial segment, grossly carious, there's no crown structure left, and most of the caries is subcrestal. We've got a very thick buccal cortical plate here. Approximately the mesial root is just 2 millimeters away from the nerve, but as we move towards the distal aspect of this tooth, you'll actually significantly be able to see that the distal root is actually in complete contact with the inferior alveolar nerve. Due to the nature of this tooth, the extraction of this tooth can lead to nerve damage. As you can very clearly see in this segment that the nerve is very closely associated right here. So there's a risk for bleeding, there's a risk for nerve damage when we will take this tooth out. So this is something that our kind doctor needs to be very aware of, that the apex is in contact and compressing the inferior alveolar nerve. So this is something that we need to be very mindful of. This is the axial view. Axial view is the top to bottom view. Here again you can see that the nerve is in complete association with the distal nerve, distal root of this tooth, and at no point is the distal root not connected with the inferior alveolar canal. So there is definitely a risk for nerve damage when this tooth will be extracted, and significant post-operative measures need to be taken in order to minimize any trauma to the nerve during extraction. Also of note is the fact that this tooth has a the tooth on mesial to it, the lower left 7 has a cavity on the distal aspect, and that cavity is just close to the pulp horns and might lead to endodontitis. So this is the pulp horn right here, and this is the cavity right here. So it is very closely associated. So that needs to be kept in mind before this tooth needs to be either restored with a pulp cap or restored with a root canal treatment. If you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.